The superpower that every citizen has is the ability to control where they spend their time, money, and attention. By focusing these on supporting local businesses, you are having a profound impact on your friends, your family, and your local community. So if you want to change the world, you can start with buying local. Welcome everyone to Buying Local, where each episode we chat with local businesses, business owners, business managers in the Warren, Washington, and Saratoga counties. These conversations are meant to educate our local community on all the great businesses, I should say, at our fingertips, and to amplify the voice of the men and the women behind those businesses. Just like we say in the intro, if you want to change the world, buy local. So before we get started, I do want to just take a quick moment to say thank you to all of our community partners. We have quite a few of them now, and we're going to try to make sure that we're focusing or that we're spotlighting each of them or a couple of them each week or each episode. So we'll jump right now to Bogey's Pub and Grill at Bay Meadows Golf Club. Not just for hungry golfers, they have a little something for everyone. The pub side offers a nice friendly atmosphere, televisions to watch your favorite sporting events, booths for a nice lunch, a pool table, PGA golf simulators with over 80 courses. They also have a formal dining room if you're looking for a more traditional dining space. Welcome back. Today we are joined here by Dr. Dan. Dr. Dan, how are you?
I'm great, Mike. Thanks for having me on board.
Yeah, no, I'm super excited to have you here. Obviously, we spoke, was it a month or two ago?
Yeah, I'd say about 6 weeks ago.
Time is flying by, man. And I know that we've written about we've got you coming out in our quarterly business magazine that's coming out right now.
Right.
I think it just went to the press yesterday, if I'm not mistaken. We also have, I think we wrote about you in...
It was Saratoga Family
magazine.
Yeah.
That's right. Yeah.
I'm on.
So, listen, like I said to you when we sat down before, I'm super excited about what you're doing. I think it's really what the medical community, but really the people that the medical community serves, I really think really need what you're doing. So, but we'll get into that a little bit more. And actually, why don't you just go ahead and tell us a little bit about who you are and what you do?
Oh, thank you. Yeah, no, thank you once again for having me, Dr. Dan, full name Dan Sooriabalan. But, I'm an internal medicine trained physician. I do outpatient primary care. I've been pretty much local for a while. I did my residency here at Albany Medical Center. Love the area, settled down with my wife here. Over the past, I'd say about 11 years, I worked at a big company, a big health network, and I loved everything, still love it. But just over the last couple of years, I felt like I really want to kind of take command of my destiny as a physician and really give back to the patients the way I felt I was trained to do. And that's kind of why I set up my own practice. I went independent to really answer to nobody but the patients. I just felt like I needed more time with them. I really wanted to hear their issues, hear their stories, be batting for them and not have any other third-party interests involved with what I'm doing.
Now, with medicine now, I mean, the private practice is almost non-existent now, right?
Unfortunately, I think that goes a lot to do with insurance and billing.
Yeah.
It's really tough to be a single owner private practice anywhere nowadays, just because it requires that high overhead cost. You have to do billing departments, coding, claims, tracking, all that, and it's tough for a solo doctor to make it work. Which is why you've seen a lot of these doctors now join forces with bigger companies, bigger networks, just to offset those costs. So it's really kind of pushed that.
Just the billing costs, right? Having to do with the insurance agencies?
Just the tracking.
Is that really what it comes down to?
Billing, EMR, coding, tracking. It's a huge overhead cost.
Just the technology side, really.
Exactly.
Yeah,
exactly.
That's crazy.
Yeah.
And now, I don't know if you can answer this. I mean, well, I'm sure that you can. I just don't know if you would want to answer it on a recording. But how do you feel that it affects the quality of care, whether it's a private practice or a large network, we'll say?
Yeah, that is a tough one. I can only answer for myself.
Sure.
I felt like my quality of care was slipping. There's only so much we can do. If you look at an average, not an annual physical, but an average visit with a patient's about 7 minutes long.
7 minutes.
After they're checked in, after the nurse gets the vitals, after we go through all the quality measures, it's a quick visit.
Yeah.
At least to me it is. So I felt like my quality of care was slipping. Not that I wanted to slip, but I just didn't have the time to really delve in. When that happens, we do what we call reactionary medicine. We we just either prescribe a medication, patch things up, or refer them out to the appropriate specialists, order testing, but they might not be thinking beyond it. You know, it's just like, hey, what can I do to fix this issue at this point in time without looking at the longitudinal part with the patient? And, you know, it took a gut check for me over the past couple of years to say, hey, this is not what I want to do. I don't want to do that reactionary medicine. I really want to, you know, take command of the patient again and make sure that everything I order is appropriate. It's not just being done because I don't have time to really think and prescribe and think and, you know, talk about diet. Sometimes you don't need medications for everything. You can talk about diet and exercise, but, you know, who has the time for all that, you know? And
yeah, when you only have 7 minutes for a patient.
It's tough. It's tough.
And you say reactionary medicine. So, you know, when I hear that, and it sounds to me like what you're saying is you're really just kind of focusing on whatever symptoms they're dealing with that day rather than the cause of the symptoms. Is that kind of like what reactionary medicine is? Or help me understand that a little bit.
Yeah. So say someone comes in with diabetes, right? So the goal is to get that A1C controlled right away, which I get it. That's a great quality measure. That's a great metric to understand and control. Sometimes getting it under control right away involves getting a medication right away. Our young folks, you know, we're seeing in society, they're obese, the diet's not the greatest. I would rather speak to them first about good diet, exercise, follow them over a week or two, follow them over 6 months, maybe talk to them every week about their diet, their exercise, but I just could not do that in the current system. Yeah. You know, I'd rather hold that metformin for a good 6 months and give them a really detailed plan on, hey, we can make this work. You don't need to be on medications. And I feel like as a society, I'm not sure what it is. We want that quick gratification. We want that quick fix. So everything is, hey, take something for it. You know, we have anxiety, take a medication. We have diabetes, take a medication. You know, we want instant weight loss. Here's some Wegovy for you. So I would rather take it a step back and say, hey, let's get back to our roots here. We don't need to do all this first. Let's work on something. Let's work on a proper plan. And yeah, it's tough, you know, when you don't have much time and you have certain metrics to answer to pretty much right away. So, yeah. I
mean, and it's interesting, you know, and I think I shared this story with you, but whenever I'm in a conversation similar to this, I tell the story that I had recently with my youngest son, who he's 3.5 now, but probably, I think it was like maybe 8 months ago. It was last year anyway, right? So it was 2022, early 2022. He just had like this runny nose that would never stop and go away. So we went to our pediatrician. Pediatrician immediately referral to ENT, right? ENT inside that 7 minutes that you're talking about. And it literally, I think it was 4 minutes. Right. Within the first 4 minutes of us being in the room, he was immediately talking about removing adenoids and tonsils. And I was, you know, like kind of stupefied by the whole thing. Cause I'm like, well, we haven't even talked about you haven't really talked about his diet or making changes there or environmental or looking at any of those things. Just kid's got a runny nose. Let's remove the tonsils and the adenoids because that should alleviate all the stuff coming out of his nose, right? So we pushed back on that, and they immediately prescribed a medication that had a black box warning on it that you know, in teens could lead to suicidal behavior, and other kids ages there was other negative things. And so again, we opted not to do that, and then, you know, fast forward, we're maybe a year after that experience, his nose isn't running. We made other changes and other arrangements, but and what it came down to though was really looking at not just focusing on here's the symptom, let's fix that. It was more about let's look at the underlying cause. And so when I hear you talking about what you do, I feel like you have more of that approach. Like, hey, I'm not going to just start saying let's get you on this medicine or let's start cutting your adenoids and tonsils out, but let's really take a look at your whole being. That's it. And what's going on.
That's it. And to be fair to all the other doctors out there, I'm sure a lot of doctors would, you know, I don't want to give anyone a bad rep, but I think a lot of us are in that same boat where we would like to do that. But once again, with time. Yeah. And primary care, good primary care. Back in the days, you know, your mom and pop doctor, we used to be the one that really spearheaded, that orchestrated everything, that knew everything about the patient. You know, so when you talk about your son who went to ENT, you know, if you had any questions, you would contact us. You would contact me first. And I would say, hey, you know, I know your son, you know, this is maybe his second or third. Right. Okay, you know what, let's try something different. Let's give it a little bit more time. Or if it was his 20th in the month, I would say, you know what, maybe the ENT is making the right decision. Yeah. So you need that person to kind of fall back on. But, you know, if you don't have access to your primary care doctor, if the care is fragmented, if you call the office and they're booked for another 2 months. Well, then you're kind of left in no man's land.
I feel like fragmented is a good way to say it.
Yeah.
For sure. It's not. I remember when I grew up, the feeling that you had, like I always saw the same doctor. It's always the same person. They got to know me and who I was, and now it could be the NP, the PA, it could be the doctor, it could could be one of 7 people that I might see now.
Sure.
So
I have this saying that I say all the time, and at least personally, I feel that fragmented care is poor care.
Yeah.
I really think that you need someone that knows you, knows your care, knows your treatment plan, and sticks to that and modifies it as we go along. We have the specialists and imaging that we order and tests that we order as an adjunct, but you really need that point person.
Yeah.
I think nowadays we're missing that point person. Like I said, you go to the urgent care or you go to the ER and something happens, or you receive some kind of treatment and they say follow up with your primary care doctor in about 4 to 5 days, and you call the office and your doctor's not available for 2 months.
Yeah.
So you see someone else, and then they do something different and they refer you back to your primary. You go back to the secretary. They say, oh, they're really not available for another 2 months after that. So you're kind of almost bandied about the system. And, I felt that for me, that was unacceptable.
Yeah. And so with your patients, they see you.
They see me. It's only me. When they call the office right now, it's myself and myself and I. There's no nurse or front office. So they have full access to me via a HIPAA compliant secure app. They can call, they can self-schedule appointments. Yeah, it's only myself that they see.
Yeah, that's amazing.
Correct. Yeah.
I think that's great. So you talked a little bit about kind of, why you wanted to do that and kind of like what makes you different from traditional healthcare. What else can you tell me about the patient experience that you're offering? So, because I think, now, like, do you accept insurance, or I think that you don't accept insurance, or you do? Or?
Yeah. So I kept it simple. I do not accept insurance, just because if I were to accept insurance, I looked at all the different options I could do. If I did accept insurance, well, like we mentioned earlier, that's why we don't see these solo doctors that much anymore, because as a solo doctor, I just couldn't make it work. So, I stumbled upon this direct primary care model, which is growing exponentially. So, no, I don't accept insurance. I do a monthly flat, what they call subscription model of healthcare, where, the patient pays a monthly subscription fee, but with that is included, visits with myself. We try to package all kind of issues that could happen in that. If it were to be an urgent care visit, a visit after hours, EKGs, urinalysis, sutures, staples, so that there's some cost transparency to the patient. So, going back to that whole patient experience, it's, they come into the office, they see me, I greet them at the front door. It's not some big environment where there's tons of people in the waiting room. Right. You don't know the person you see. The secretary you see one day might not be the secretary you see a different day. So it's me. They know it. They know what to expect from the office, what to expect when they see me. And the model is just geared on just good care, and they can use it as many times as they want or as less times as they want. They can contact me anytime, if say after hours you have any urgent issues. Like yesterday, I just saw a patient with a bronchitis on a telehealth, so they contacted me at around 7 p.m. and we dealt with that right away. Yeah. So really avoided that urgent care visit. I had a patient that we drained some small abscesses last weekend. So the goal is, with the subscription model, a lot of people have these high deductible plans nowadays. They're paying co-pays for visits. They're paying, who knows how much for a visit fee. Yeah. And sometimes seeing your doctor 2 times a year or 3 times a year, throw in an urgent visit with that can actually end up to be much more than your annual direct primary care subscription costs. So really trying to make it as cost effective, cost transparent, and affordable for the patient as well.
Now, how does it work? So let's just say myself, right? So I'm going to come in, I'm going to sign up for your subscription plan. And then I think you said it's unlimited visits, right? I can see it.
Yeah, as many visits as you would like. And when we calculate this cost, there's no rhyme or reason. So I just go with the kind of the national averages. You can see me as many times as you would like.
Okay.
Yeah.
And hopefully they're fewer, right?
But, and I tell whatever it takes to get things sorted out, you know, like I have a diabetic patient who really doesn't want to do medication. So we talk to her about twice a week. Okay. Really get, and that's the initial stages, right? So the goal is education. The goal is empowering the patient, really. My goal as a doctor is not to sit here and say, hey, I'm the doctor. I got the degree. This is what you have to do. This is the meds you have to take. Mm-hmm. My role is each patient's different and we can't fit them into an algorithm. So my goal is to really empower you and teach you early about different options and then let you make your informed decision for your best treatment and for your health.
Yeah.
So, yeah.
And so how do you deal with like catastrophic stuff, right? So if someone, because I know the idea is like, well, hey, listen, because you're right, the insurance plans are ridiculous, right? Unless you've got a job that that pays for your health insurance, most of us are paying $500 a month or whatever it is, and then the high deductible, and so it's $10,000-$12,000 a year before insurance even steps in. Correct. And so that's expensive, right? So someone might be like, well, maybe I'll switch over to Dr. Dan and do his affordable plan that he's got going on. But what happens when it comes to the heart attack or the cancer diagnosis or any kind of that stuff? Yeah.
So full disclaimer, what I'm doing is not insurance. I'd still recommend people have some level of insurance coverage, be it, catastrophic illness, but it's just the care that they receive from me and in-house is covered through that subscription model. Yep. So any kind of catastrophic, or say, I have a limb falling out where you have to go to the the ER. Yeah. Or, you're having a stroke where it's pretty obvious, certain things we have to use, our resources, our ER. But I feel, if I can keep as much of my patients out of the ER, out of the urgent care, a lot of these visits are just because you can't get into your doctor, and the only other option is the urgent care. So,
I know. Yeah.
So obviously that's my goal, is to hopefully decompress the system, do my part. But obviously if there are some issues that require you to go to the emergency room, you to go to, orthopedic urgent care, then, I will advise my patients to, hey, listen, you have to go. I'm sorry, but this is beyond the kind of level of care you can receive here. And use your insurance, Obviously, like I said, the care we receive is not insurance in my clinic, but it's a subscription base. But I still bill their insurance. We still have to, in New York State, we still have to bill your insurance for lab work, imaging, referrals. So I use all the local imaging facilities, all LabCorp, Saratoga Hospital for, lab work, but just everything in-house is covered through that.
Well, I mean, certainly, for many of the non-catastrophic things that we deal with on a day-to-day basis, right? Much better to see you than to sit for 7 hours in an emergency room.
There you go. A pink eye, you don't have to be in too much for urgent care. They say there's some statistics out there, and I have to quote them, but they say good 80% of your care can be taken care of with a good primary care. Yeah. You don't have to go all around for good care. I mean, certain things that your primary care can take care of. Yeah, for sure. So it's really filling that primary care. And that's how the system really works anyway, right? Like if you get a cancer diagnosis, you're going to start with your primary care physician. They're going to do some initial things for you, and then they're at some point going to refer you on to an oncologist or whoever it might be, I assume, right? That's it. It's not rocket science. It's really just bringing healthcare or medicine back to its roots. That mom and pop, that doctor that you knew that you would call all the time, that would diagnose that cancer first and foremost, refer you appropriately, or the right testing, and then not just saying, hey, we're busy, go follow up with your oncologist, but saying, hey, let's talk after your oncologist sees you, and let's kind of figure out what they're saying. Let's see where you're at with things and taking it from there. And would you say that you really start to become an advocate for your patients when they're working with other specialists? Because that's kind of like what I hear from you, right? Is like you're going through a cancer diagnosis and you're dealing with an oncologist, and you need someone that understands what's happening that can help you. That's the way primary care was intended to be in the first place, right? That advocate for the patient. And, the patient always has questions, when we see specialists, nephrologists, oncologists, cardiologists, or they go for other testing, sometimes the system that the specialists are in, is rushed as well. They don't give too much of information as well. And sometimes they have questions, but who better to go than the person that knows you? That's your primary, your point person. So, the goal is to be the advocate for the patient, really digest everything and be the point person for them, that they know that no matter what happens, there's someone to fall back on. Yeah.
1-800-PAINT JOB. Professional painters and pressure washers providing high-quality paint jobs and close client relationships to bring great ideas to life for over 30 years.
So what do you think are some of the biggest trends, or what kind of things are you seeing in the health landscape right now with your private practice?
Yeah, I honestly, I did not know what to expect when I started. My goal was just to provide care and, wake up in the morning, know that I'm giving good quality of care. When I feel like that stopped, or that I could not do that anymore, that was a problem for me personally. So the trends I'm seeing with this now, I think there's a huge need. I did not know what to expect in the first month, or, I've been open 6 weeks now. It's been a year in the making, but I told myself my goal would be 100 patients in the first year, and we're up to 82 already in 6 weeks. So it's been going great. But the trends I'm seeing are just, like I said, this is not a competition, amongst primary care doctors, because God knows we need tons of primary care doctors. There's going to be, they anticipate in the next 10 years, a 40% shortage in primary care doctors.
That's crazy.
Yeah.
Why is that?
We have an older workforce that's retiring. Obviously, with certain models we're bringing out and medical records, and some of these doctors just find it's a little bit too much. They retire a little bit earlier than they should have retired. We have the young folks who might be getting burnt out. They feel like it's easier for us to maybe join an insurance company or a pharmaceutical company or do something totally different than medicine. And then also the supply that's coming into medicine. The younger folks maybe don't want to go into primary care because they know it's a rat race. It's seeing a lot of patients, billing high, less time with the patients, and sometimes that's not what they want. So they specialize, they go into different types of fields. So the trends I'm seeing right now are, medicine's always trending, but I think there's a need. I think people are seeing that, hey, listen, there's something that they're lacking. And I always say that, our society is so transactional based now. Everything is a transaction. There's really not much personal touch to anything nowadays. And I say healthcare should not be a transaction. I'm seeing that in the community, that people want that relationship with their doctor.
Yeah. There's a comfort in that.
There is. We see our barber. We go get our haircut for 10 minutes. We spend more time with them, spend more time talking with them than with your primary care doctor. So for me, that was unacceptable.
Yeah, I always, spending more time in the waiting room than I'm actually spending with my healthcare professional always kind of bothered me, because I have a 2:00 appointment. Of course, I don't get seen until almost 3, and then I'm in there for 7 minutes, right? Like you said, right? And then I'm out the door, and it's like, man,
right. And once again, to be fair to all the other doctors out there, I'm going to get pitchforks after this. But,
right. No, it's not Dr. Dan saying that stuff, guys. It's me.
To be fair, it's just it's tough when you're seeing patient after patient after patient, and say one patient comes late, that slows your whole productivity, your whole system down much more. So your patients are waiting in the waiting room, and and
I don't blame the players. I blame the game.
Sure,
I think it's just the system has kind of gone in that direction, and like you're saying, like I know that even the ENT that I'm talking about, I don't think he was a bad doctor or a bad human. I think he was doing the best what he could do inside the system that he is being asked to work within.
Right.
And I know a lot of that is because a lot of it has to, again, these hospitals and organizations, they're still businesses. They still have to make money, whether they're getting supplemented, which some of them do or not, but they still have to have more money coming in than going out. In order to do that, they need to see as many patients as they can.
And we need our hospitals. We need our ancillary facilities. We need our urgent cares. We definitely need them to thrive and succeed. And, if we take, I can speak on the primary care. And like I said before, if we can't get the patients in to deal with a big majority of problems, and we're getting them to urgent care in the hospitals, well, then we're draining the system.
Yeah.
We're not doing our part as primary care doctors in making sure we're decompressing the system. So, I feel bad for the hospitals, and, they're trying their best, and the urgent cares are doing their best too. But at some point when the volume gets too much, the care can slip.
Yeah.
So,
it's unfortunate. So I know that we're probably getting short on time here.
Time goes by fast.
It really does. Yeah, I know. And I'm always like, all right, I got to make sure I get everything in, and I've got 500 more questions. But so if you're going to tell, the listening audience one thing about who you are and what you do, what would it be?
Yeah, and I think it's in my slogan. I spent hours and I had a friend. I got to give credit to Todd Bailey who helped me with the slogan. But I think that's perfect.
Todd is great at slogans.
Todd is incredible. So
he's an amazing photographer. He's almost as good at slogans.
That's right. So he kind of took everything that I believe in, and he helped me figure this out. So I think one thing I can tell patients, my slogan is rehumanizing healthcare, one patient at a time. It's to bring that human touch, that human element. Nowadays, with everything being computerized and AI and rushed, and it's easy to feel like you're just a number. You're just you're just someone else that the doctor sees. But from if I can get anything to my patients, it's not competition. If I can get my patients to be better people, to walk out of that clinic like they feel human again, that someone's there listening to them, and that they know that they can come back to me anytime they want, well, I've done my job.
Yeah. It's funny how much people just want to be heard.
That's
In every aspect of things now,
Every
right?
aspect
And
of
it just
things,
seems like it's going away. It's going in the other direction so fast and so hard. So it's nice to hear that
exactly.
you're doing what you're doing. And like I said, I'm excited about it. I think it's an amazing thing that you're doing. I think I said this to you last time. It's people like you that are willing to take risks and go against the system and kind of go out on your own or do whatever it takes to be able to really make a change for the better. So
thank you. It's a lot of work. The medicine part's easy for me. The whole business and everything else has been very tough, but you learn as you go along. It's been a great learning experience. I wouldn't change it for the world. And yeah,
it's awesome. So if people want to find you, they want to learn more, they want to maybe get on board, where do they find you?
Yeah, I think the best way is I try to get as much information on my website as possible. So obviously they can call me directly. They can text me on my phone, my office phone, which is on the website. But I think the website has tons of information. I now have a video posted on there too. There's a great frequently asked questions, but it's www.drdanmed.com.
Perfect. Well, thanks again for coming. And thank you, everyone, for listening to today's show. If you have not already, please hit the subscribe button on YouTube, Apple Podcasts, Spotify, or wherever you're listening. But more importantly, if you like today's show, please send it to someone that you think will get value out of it. Maybe someone that's looking for a new primary care physician. And, it could be a friend, a colleague, a family member. But together we can really make a difference in our local communities. And so share the show. Thanks, everybody. Thanks for listening. And Dr. Dan, thanks for coming, man.
Thank you, Mike. And thank you for everything you do. I'm honored to be here. Thank you very much.
Thank you.
The superpower that every citizen has is the ability to control where they spend their time, money, and attention. By focusing these on supporting local businesses, you are having a profound impact on your friends, your family, and your local community. So if you want to change the world, you can start with buying local.